Currently, most dentists will train using a combination of sophisticated jaw models and phantom heads in order to practice all manner of treatment scenarios. Everything from basic preparations to root canals can all be learned and perfected with these systems. In fact, they've proved so effective that Morita has sold over 2,000 cleansing systems alone in Japan and 200 more internationally. However, there are several problems with this training system. First, it's non-interactive. There's no feedback to the dentist while they're working. Secondly, it does not prepare the dentist with the realities of managing an actual patient during treatment. Dentists must prepare themselves to deal with medical interviews, hygiene, explanation of treatment strategies, and even monitoring of patient vital signs, all without an actual opportunity to practice and demonstrate these essential skills. In the end, as he said, dental students have been treating only a tooth and not a human being. But there is a solution. Introducing the Simroid and the future of dental education. No video this time. Simroid bridges the gap between the phantom model and the patient and gives the dentist an opportunity to practice not only techniques, but the interpersonal skills necessary for successful practice. Simroid is interactive, but more importantly, she's reactive. We believe that Simroid will provide the most thorough and well-rounded training possible for aspiring dentists. Morita has long been a pioneer in dental education, and with the latest advancements in technology, we can now provide the next level in simulation systems, actual patient simulation. The Simroid system provides dentists with an interactive patient who responds to questions and requests the way a real patient would. Let's have a look.
Good afternoon.
Good afternoon.
I'm Dr. Morita.
Hello, doctor.
What is your problem today?
I have a toothache.
When did it start hurting?
2 days ago.
Alright. So as I said, Morita has long been a pioneer in dental education. The Simroid system provides dentists with an interactive patient who responds to questions and requests the way a real patient would. But more than that, the system provides a patient that reacts not only to commands, but can also show discomfort or even pain, and react to treatment in a way that phantoms are simply incapable. The dentist can not only practice necessary techniques, they can do so while practicing the interpersonal skills necessary to work with real patients in a real clinical setting. Of course, as with any training system, it requires a way to evaluate participants and chart their progress. This too is an integral part of the Simroid system. Simroid's development began with the selection of the Nippon Dental University for the Ministry of Education's Training and Assessment Program. Through funds from this program, the university developed a patient head for clinical simulation. However, it was not adequate, and they lacked the technical skill necessary to realize the system they truly wanted. In 2006, the Nippon Dental University signed a contract with the J-Morita Manufacturing Corporation to develop Simroid. Work on the initial prototype, including the patient robot, was completed 2 years later in 2008. With a working prototype, we applied to the Japan Science and Technology Agency for a commission to develop Simroids for commercial purposes. This was accepted in January of 2009. Development continued on the final commercial product, and it was approved for sale in April of 2012. Now let's have a look at the main components that make up the Simroid system. In total, there are 4 main systems that work together to provide a complete training solution. The first is the treatment unit. This can be any of our current line of treatment units, including our award-winning solution shown here. The second, and the star of the show, of course, is the patient robot. She is activated by the air supply to the treatment unit itself, meaning no additional hardware needs to be installed or lines. Next is a pair of CCD cameras that capture not only the intraoral cavity, but also a wider field of view so that the trainer can evaluate both technique and patient-dentist interaction. All of this information is stored and processed by a software suite specially tailored to control robot movements, evaluate treatment scenarios, and manage workflow. In order to achieve a more natural and lifelike appearance, the robot incorporates a wide variety of electronics to control both subtle and extreme motion. Many of these movements require no commands or interaction whatsoever. These include blinking and the subtle head movements that any patient would exhibit in a similar situation. All of this working together reinforces the fact that the dentist is working on a patient and not a static mannequin. In addition to the robotics beneath the surface, the special polymers that make up the skin of the patient robot give it a high degree of natural elasticity, which allows the dentist to practice techniques within the confines of a more natural oral cavity. Dentists can even take impressions and use a wide variety of dental dams, again, just as they would in practice with a real patient. So let's have a look at how this comes together in a brief training session.
Yes, my mouth feels fine now.